Hi, I'm Michelle Green, a psychologist and associate professor at Rush University Children's Hospital. On behalf of my colleagues, I'm going to be presenting the results of our manuscript, Infant, Maternal, and Neighborhood Predictors of Maternal Psychological Distress at Birth and over Very Low Birth Weight Infants' First Year of Life. Very low birth weight infants, or VLBWs, are infants born weighing less than 3 pounds, 5 ounces. Delivering and caring for a VLBW infant in the neonatal intensive care unit is often unexpected and is very different from a mother's imagined full-term delivery and healthy baby. Given these experiences, psychological distress, defined as mother's depression, anxiety, and perinatal post-traumatic stress, is understandable and common. This distress does warrant investigation for mother's quality of life and because it's been shown to impact mother-child relationships and child outcomes well after NICU discharge. Our study assessed mother's depression, anxiety, and perinatal post-traumatic stress 1 month after child's birth, 2 weeks prior to discharge, and an infant's 4 and 8 month corrected age. We used a statistical technique called multi-level linear modeling that allowed us to estimate levels of distress at time of VLBW infant's birth and model rate of change in distress over time. Multi-level linear modeling also allowed us to determine which maternal, infant, and neighborhood variables predicted distress at time of VLBW infant birth and rate of change over time. Interestingly, we discovered that higher rates of neighborhood poverty related to less perinatal post-traumatic stress at VLBW infant birth, and that low income status predicted lower reported anxiety at time of VLBW infant birth and rate of change over time. There are other studies of distress in parents of preterm infants that also reveal that mothers residing in lower income environments had reported lower levels of psychological distress than hypothesized. There are several possibilities for this. One is that for mothers facing economic or social stress, that their lives are so saturated with stress and anxiety that the birth of a VLBW infant does not exceed the threshold to warrant notable anxiety relative to their daily lives. Or that they experience so much chronic stress that their emotional response to delivering prematurely might be blunted. Another possibility is that for some reason, mothers might be knowingly or unknowingly underreporting distress on questionnaires. At any rate, this seemingly counterintuitive finding warrants additional research. Additional research that incorporates another methodology of assessing distress, such as diagnostic or qualitative interviews, might be helpful. Additionally, studies that investigate maternal psychological distress and include a control group, such as mothers residing in lower income environments but with full-term infants, would advance research. Our study also revealed that lower birth weight predicted higher anxiety at birth and anxiety over time. This is consistent with previous literature that also indicates that VLBW infants' medical severity predicts maternal psychological distress. Finally, the present investigation reveals that older maternal age predicted lower maternal depression at time of VLBW infant birth and decline in depression over VLBW infant's first year of life. Overall, this is consistent with previous investigations that have demonstrated that maternal variables, such as relationship status or education, also predict depression throughout a preterm infant's first year of life. Regardless of the distress evident, overall, mother's psychological distress declines over VLBW infant's first year of life. Psychologically, mothers recover. This recovery does not negate the need for intervention for mothers of very low birth weight infants. We hope that our study validates, reassures, and normalizes that for mothers, their distress is significant, but overall does tend to improve over time. We hope that this study identifies mothers at greatest risk for psychological distress, and we hope that this study informs future NICU-based psychological interventions. Thank you.